Good afternoon, everybody. My name's Scott McGann with the Town of Falmouth Health Department. Today is October 8th, 2021, doing our weekly COVID-19 update. Our website is falmouthma.gov. We'll put this presentation up on there, plus we'll put the numbers, the weekly numbers that I keep going on there, that I keep putting on there. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So we had a much better week this week. We're at 1,954 cases since the beginning of the outbreak. These are confirmed PCR cases. 17 confirmed during the 7-day period, which is definitely way down than we've had, earlier, definitely in September. One probable case for the week. 98% of the people no longer in isolation. Our 14-day incidence rate, which is the number of daily cases we would get if we had 100,000 people in the town. So it's an incidence rate that puts the population at 100,000 so that all towns could be looked at equally, because obviously a town with a lot less population would have a lower number of cases. So it's an incidence rate based on an assumed population of 100,000. We were at 18 daily cases per 100,000 for the 14 days previously. These are based on from 9/19 to 10/2 data. And we went down just under 8 to 10.8. And that number has actually continued to go down because this is as of 10/2, and here we are 6 days later, and we've had even better sort of case counts this past week. So that's driving downward even from 10. Our percent positivity dropped from 3.21 to 2.02, and again, that's all tests in the same time frame, divided into the number of positives divided into the number of tests, and we have been averaging somewhere around 1,300 cases tests per week. If you look at our chart here, you can see in the far right that we had sort of on a little bit of a roller coaster on the downward trend. We went up for 3 weeks, mid 50s, mid 60s, low 70s, and then we dropped down 30s, 20s, and teens. And hopefully that's a trend that continues. So that's each dot represents a different case count per the week, and you can see sort of the ebb and flow of this, and so that peak is on its way down. Hopefully it stays that way. Looking at this chart just shows the flatter and more closely clumped together those circles are. That's the better times where we're not having spike in cases. The more vertical this chart goes and the bigger spread there is between these dots, those are the worst weeks that we've had. So with sort of, this is that flatten the curve chart, and you can see where we're in a much better trend over the last 3 weeks. Countywide, this is all the cases over 3 day, each number represents a 3-day period. And what I did this week is I usually show you on this. What I did is I superimpose these lines on the right. 50%, 66%, and 80% is our vaccination rate. So the cases were the highest in green. That was the holiday season into January. Then we had that second one in blue, which was in the spring over with Mid-Cape had a blow up, and it kind of worked its way towards other towns, including us. And it was on its way down, and when we hit 50% vaccination sometime early, right in late, maybe early first week of May, right at the end of April, the cases continued to go down, and then the mask mandate was lifted on the 29th, and the rest of the ones with the mask mandates and the guidance, that's just not just mask mandate, that would also be guidance. You can see that it really dropped off in June. And it would have stayed down until it hit 66% right around early June. And then in that orange line, that's when we started to see yellow-orange color, start seeing Delta. And I thought what was interesting about this, and the green line showing 80% vaccination, is we know that Delta is about at least twice as more spreadable than old-fashioned COVID, or the original version of COVID. But you can see, the one thing to look at this is you can see that the orange, all the ones on the right from Delta are all sort of shunted. There isn't this big spike and down like you saw in the blue and the green. Knowing Delta is twice as spreadable, the mask mandate being lifted, the brownish colored should have been way off the chart, and it would have been way off the chart because Delta would have been twice more cases than you normally would get with the original COVID because of its transmissibility. The vaccine has definitely helped it because we have no mandate. If you took away the mandate, it might even have been another magnitude higher. It could have been 600 3-day cases. So it would have been 200 a day in the county. So this chart, I think, just shows that the vaccine works. Obviously, it would have worked better if Delta never showed up, But the fact that, that this spike didn't occur and it was sort of shunted from being a large spike, I think has got a lot to do, obviously, with the vaccine. So I just thought that would be interesting, a little something different than I normally give you every week. As far as hospitalizations, it's been sort of a holding, similar pattern for the last 3 weeks between the two hospitals, the daily counts in the teens. This isn't daily new cases. This could be the same individuals in there for multiple weeks. But you can see it's sort of been in a sort of similar pattern, 6-1, 5-1, 6-0 over the last 3 weeks. A little bit higher than what we saw in early September, but still around, not roughly in the same ballpark for hospitalization. So we haven't seen a surge or anything of that nature. Statewide, it's pretty flat. It's been right in the 1,500 or so, 1,015, right around there per day. The positivity's been staying under 2 now for a little bit of time. A lot of tests, 100,000 per day in the state. So things have been relatively similar. I look at this every day. You can look at this, it's looking right on your phone or your computer. And if you look at the trends, you can see there's much flat. When you look at deaths, it's been relatively flat. You definitely look at positivity is on a slight downward trend or flat. Hospitalizations has been relatively flat now for a little bit. Cases are a little on the downswing, but it's been, we're not in a point where you're starting to see that really rise up. So again, highly vaccinated, Delta works its way through. So I'm fairly, slightly optimistic to see that at least we're not seeing an increase in the state and we're doing better here in town. 14-day average incidence rate, again, this is the average day cases you would have per day if your population was 100,000. The state's average is 20 for a daily incidence rate. We're about a little half of that. We were a couple weeks ago higher than the state. So we're in a much better spot at 10.8. And looking at our peers, this is all the different towns' incidence rates on the Cape. You can see that we're usually where we are is in the mid to lower, usually right around the midpoint of where the rest of the towns are on the Cape. Percent positivity, we're slightly higher by 0.1. By a slight margin. So you see that some of the positivities are slightly higher. Again, we're probably in the mid-range for where the rest of the towns are, but the positivities have definitely dipped everywhere. So again, good sign on the Cape. Vaccinations, no change in the 73% fully vaccinated for the county. For us, we had a good increase. We had 329 doses administered, which is definitely the last 2 weeks I've seen an increase. I think that's got to do with some of the and this does not include, I checked with the state today, this does not include third doses. So these are first and second doses. You see that increase. I think it's got a lot to do with the mandate for businesses, over 100 employees. Some employees are getting vaccinated because you've seen the 219 new first doses in 7 days is a fairly robust number from what we've been seeing previously. And you can see that the increase has brought us to 81% first dose, and we remain 73% fully vaccinated among all residents. If you take out those that are not eligible, we're at 89% of first dose. People have had first dose. 81% of all eligible residents are fully vaccinated in the town. So we keep plugging away at that. Eventually, there'll be another category. Eventually, I think they'll have the 5 to 12s, at least with Pfizer. In the near future, maybe mid-fall, maybe sometime in November, maybe a month out or so. And then, of course, we'll be doing school-based clinics for that and getting as many as we can done. So there'll be another category added. It'll be 5 to 12s. There'll be another category added in this chart. COVID cases among fully vaccinated individuals. If you've been fully vaccinated, there's been 40,464 breakthrough cases. So of all residents that have been vaccinated in Massachusetts, less than 1%, 0.87%, have had a breakthrough case. Of those that have had breakthrough cases, the hospitalization rate has been right around that low 3% range. And of the 40,000 cases of breakthrough, 300 deaths, which is 0.74. So less than 1% of the population who has been vaccinated has had a breakthrough case. And if you've had a breakthrough case, 3% of those breakthrough cases have been hospitalized, and less than 1% of the 0.87% have died from it. So that tells me that obviously that the vaccines are working. Delta is, to me, a bit more severe, does cause more severe disease, and the fact that we're vaccinated and these numbers are relatively low, and when you look at the totality of how many people have been vaccinated. Vaccine availability, again, vaxfindermass.gov. Pharmacies are going to be a main source. The health office at Barnstable County up on 6A at the complex where the Registry of Deeds are in the Superior Court. They do a weekly clinic, I believe, on Thursdays. Convenient MD did have some last time I talked to him. Community Health Center can do it. Homebound, if you can't get out to a clinic, can't get out to a place, call us. We'll call the health department. We'll make arrangements. You're not going to see, the big clinic open up at the fairgrounds at this point in time. It's all, we'll gauge availability, and if the pharmacies in our current system are sufficient for booster shots. It's definitely been okay for our vaccinations since about August, July. This has been suitable for people to get vaccinated. I check in, the pharmacies seem to have a lot of availability. If boosters sort of push that towards we need to do something else, then we'll do something else. We can obviously supplement the what's going on now, and we'll gauge that on a weekly basis, and we'll keep making sure that we'll be able to service the residents who are looking. As far as testing, again, school is a test and stay program that is working out much better. Again, in the first couple of weeks, we started on the warm side for cases, hot for us, I guess, and the test and stay is a new program at the schools, and they've gotten their groove, and I think things are better there. You can, again, Convenient MD and CVS do a lot of testing. Falmouth Hospital, again, still has the testing. You would go through your physician for that. That needs an appointment. Fairgrounds have Sunday and Thursday. It's free from 4 to 6. And the Community Health Center of Cape Cod, especially if you're a patient, they have a mechanism for that as well. So, again, we're doing 1,200 or so tests per week. That's a pretty good amount of tests, and so the availability seems to be there. And so that's where we are with both vaccine availability and testing. This slide, again, same slide as last week, booster eligibility. Individuals who are immune compromised are eligible for a booster dose of Pfizer or Moderna, and that's been available to them since August 13th. Over about 2 weeks ago, if Pfizer, and if you had the second dose, and it's been at least 6 months, people 65 and older, residents of long-term care, different underlying conditions based on your age. So 50 to 64 is a little bit more open than somebody 18 to 49. There's different medical conditions. And anybody who works in an institution where there's a way of a higher rate of transmission, long-term care, hospitals, congregate settings, places like that would be eligible at any age. Okay. Do you need to get the same brand of vaccine for your booster? The answer is yes. So if you got Pfizer, get Pfizer. If you got Moderna, get Moderna. If you got J&J, I don't have any information on J&J yet as far as boosters. I'm waiting on it. If it's come out since, I looked a day or two ago. I didn't see any new information. I keep an eye on it. When I get information, obviously, I'll put that in both on our website and here on our updates. Face coverings, again, we're still in the same point for face coverings. May 25th, we had a mask advisory. The state wants people, as of July 30th, unvaccinated people vaccinated with weakened immune systems, or people doing public transportation should be masked. The CDC says vaccinated should wear masks indoor public spaces. Unvaccinated should always wear masks indoors, basically is what it says. Vaccinated should also wear masks indoors of areas of substantial or high transmission. And schools definitely have a state requirement to start the school year. And I think they're going to hit 80% vaccination in a school for it to be lifted. So looking at the CDC's substantial or high, and what makes substantial or high is anything to the right of that orange line. So substantial is a daily incidence rate of 50 to 100. An incidence rate of 50 for us is about 117, 115 or so cases per week. Or positivity that gets above 8%. So we're on a downward trend right now. We're still moderate by 0.8. We went down 7.5 in our daily incidence rate from the last time this was run. It's still on a downward trend because it hadn't captured all of several, the last particular week where we did particularly well. and our positivity has dropped. So we're in that still low to moderate. So you add that with hospitalizations being relatively stable without surge, and again, we've got a strong vaccination. The Board of Health, which I report to, we're using this chart, and that's sort of where we're sticking with it, unless things start to go sideways then or increase, then, we weren't far from considering it if I go back to that slide that shows you the spike. If I could just scroll back up there quickly, going back to the right, so you can see that in that late August or the mid-September, you see 1, 2, 3. We were another week or so from an increase from doing it. So that would have pushed us, another couple of weeks, could have easily a week or two pushed us into a substantial on either one of and especially with incidence rate. But we're in this sort of downward trend, so that's kind of where we are with that. And again, as a recap, case counts have decreased significantly in the last 3 weeks. Good trend. Vaccine eligibility, everyone over 12. 5 to 12, keep an eye on it. If you got somebody who's 5 to 12, looking probably sometime in November, I would guess. Third dose booster information keeps getting updated. Keep an eye on it. If you're savvy enough on a computer, you might want to bookmark that page and refresh it every once in a while and check on it. And as I get the information, I'll post it on the website and obviously during our weekly update. Again, vaccination rates are great. Third doses are recommended for immune compromised, and also if you had Pfizer, the list I gave you, if it's at least 6 months. Breakthrough definitely occurs. I got a call on that this week, somebody to ask me about breakthrough definitely happens. We have a high population of vaccinated people, so these cases, there's going to be a percentage of those that are vaccinated. But it is highly effective in preventing severe cases, and you can see that when I show you the 40,000 people that were breakthrough so far in the state. And another update, flu shots, I have a couple calls. You can get your flu shots easily at the pharmacies, maybe a physician. We'll be doing clinics as well, so I'll probably be posting those next week, I think. Just going to firm up the date. Trying to get some high dose because there's some interest always with the elderly and wanting the high dose flu shot. So I will be posting those hopefully in the next week or two. Those clinics will probably be in early to mid-November. So we'll be posting some of that shortly if you've been concerned about getting your flu shot. But again, you don't have to wait for us. Back about 10 years ago, the pharmacies were able to do flu clinics that really sort of took it off our plate. We used to run much larger clinics because we were one of the main places health departments were to do flu shots. We'll still run it, but you don't need to wait till mid-November until you go to a health department run clinic with the VNA. If you look at when you go through the pharmacies, it's real easy to get your flu shot. So you don't have to wait for us. We'll be there if you want it. We're going to do it. We're just working out some of the details at this point, and we'll have it posted shortly. So that's what I have for an update. And again, any questions you can email or call the health department. And again, I'll be doing another update next week. So thank you. See you next week.